welcome everyone to our healthcare automation virtual event. The focus today is on optimizing the revenue cycle for community health centers with generative AI. So pleased to have over 350 plus healthcare professionals registering today for this event. So without further ado, let's do some introductions. So Ranodeb Banerjee, he runs healthcare automation here at OpenBots and is known to be somewhat intelligent. He's some clients call him an SME or a subject matter expert. But Rano, any words or anything you wanted to mention?
No, absolutely. First of all, good morning, good afternoon to all the audience out here. I mean, this is a topic, once again, which I am incredibly passionate about. Like you said, some clients do think I am a little bit more intelligent than you when it comes to healthcare stuff. So this is the right opportunity for me to show my intelligence, perhaps. But yeah, I'm looking forward to it very much.
We'll let the crowd decide who's the winner of that. So my name is Gabriel Skelton. I am the head of artificial intelligence solutions. Very happy to be speaking here with Rano. Before we get into it, so the company we work for is called OpenBots, and it's basically just an automation platform designed to handle unstructured data and, of course, data entry into EHRs, payer portals, and other systems. The big topic here in terms of using automation within community health centers. So let's get started. I think, Rano, the first question I wanted to kind of dive into is how are community health centers different from typical providers? Tell us a little more about that.
Well, I think the one-liner for this is community health centers forms the backbone of the US rural health system. So community health centers are available in places where people don't have that privilege to access medical facilities, be it in terms of the monetary reasons, be it in terms of the type of services they want to procure. One good thing I read about community health centers is that they don't care about what type of insurances you have as a patient, regardless of whether you have insurances at all. They're going to provide you with the best possible care. And that's primarily the biggest difference between a community health center and a large financial healthcare institution.
Yeah. And we found that almost any type of provider, regardless of what direction they go in or what they specialize in, they tend to have pretty similar problems and similar issues that they're dealing with because there's so much manual work needed within healthcare operations. So one question is, AI. Why AI? Like, why does a community health center need AI? Is it essential? And if so, why is it essential?
Yeah, I mean, in general, providers do need AI. This has been the topic over the last 2 years now. Like, where can AI be used to optimize efficiencies? Let's talk about community health centers for a second. What are some of the biggest challenges they are facing? The first big challenge they are facing is limited administrative staff or staffing shortages, and you talk about resource shortages, staffing shortages. When you talk about staffing shortage, it comes in form of administrative task or clinical task, right? Like you don't have X number of members you need to be on the patient access side, or you need to have 7 or 8 members in the medical billing side. You don't have that. Can AI be a replicated option of it? I think perhaps the answer to that question is yes. So that's one of the primary areas where AI can address the resource shortages. The second point that immediately comes to my mind, Gabe, is limited access to care. Like community health centers is, designed to serve the patients in rural areas. When it comes to specialist cares and stuff like that, you won't have that access in rural areas. So there are a lot of AI-based telehealth platforms which can provide remote access, remote consultations to patients. So you can even ensure timely access to care being in a remote location with the help of AI tools. So these are the two areas where I think community health centers can definitely leverage AI to be at par when it comes to the quality of care they're providing.
I love that. And there's such a large talk around burnout and how big of a problem burnout can be. It's an industry that requires staff to be at 100% at all times. It's one of the most important jobs in the world, no matter what you're doing
Correct.
within the healthcare provider space. So talk to me a little more about specifically within revenue cycle for community health centers. Tell us a little more about how AI can generally be used, and then we can dive deeper and deeper and deeper, but kind of give us an overview there.
Yeah, absolutely. Uh, so first of all, community health centers operate with tighter budgets compared to other private healthcare systems or healthcare providers. So efficient revenue cycle management is super important for them to maintain the financial stability. You talked about revenue cycle management. Some of the areas where I think AI could be leveraged, or not just AI, even typical bots, AI agents or automation could be leveraged, includes claims processing, certainly, denials management. Of course, if you think about collecting payments from patients, that's like a one trigger button where AI can definitely send reminders to patients to pay for their bills. Finally, if you even think about revenue cycle management, the first thing you're looking at is verification of insurances. So all of these 4 to 5 points, which I just touched on, are the areas where community health centers can look for AI as an option.
And it's interesting because even security is talked about a lot, and basically how you can actually utilize AI within operations to make things more streamlined. So talk to me a little more about the patient experience specifically as well, like when it comes to patient engagement and what you can do for that. Tell us a little more about how unstructured data is involved there and how AI can help with manual processing.
Yeah, I mean, you talked about burnout a few minutes back, Gabriel. Burnout. Now, if you look at burnout for a reason, burnout is a direct consequence of staffing shortage. And staffing shortage primarily happens in the front end side of things, which is clinical documentation. You need to take data, be it a lab report, be it a medical history, be it all the documentation which is piled up for years within an electronic health record. Now, what are we trying to address here? We are trying to address unstructured data. Now, unstructured data would be there in healthcare. Healthcare is kind of still a vertical where paperwork holds 90% of the stuff. The technology, even 5 years back, wasn't available to that limit where you can grab a fax, be it a referral fax, be it a prescription, be it even a clinical note in a handwritten format, where you can simply trace the information from there, synthesize the information, and push it to the EHR instead of your patient access member doing it. Now, that's one particular area where technologies like OCR has kind of gone to a high level. In today's world, you have OCR that are combined with large language models that can immediately address this problem. Let me tell you one of the core focus areas of OpenBots. OpenBots has been in this healthcare space for a while, and one of the things we do is to basically grab large data sets, synthesize the particular information from the data sets, and extract meaningful insights from it. As a use case, we can basically look at a file of 100 faxes. Within 10 minutes, we can extract the data from the faxes and then kind of put the meaningful data in your electronic health record. And that's where perhaps this is the right time to use the new technologies that are available, like AI, like large language models, like computer vision, instead of solely depending on humans to do it. Because as you and I, we both know, humans are not 100% accurate, though it is claimed to be the case.
I love those points, especially even before that, in terms of if you have a limited budget for AI, the way that community health centers do, it's not about, hey, you know what, we can't use AI, or hey, look at that company bigger than us, I can invest in more things. Well, first of all, you're more nimble. Number two is it simply means you need to be much more precise with your AI budget and have basically needle precision in terms of the problem you are looking to solve or the area which you're looking to basically digitally transform. And number
Right.
two is one of the biggest trends that you're mentioning, Rano, is that generative AI made a huge dent in being able to make sense of unstructured data. And
Correct.
when it comes to the healthcare industry, the majority of this unstructured data happens to live within documents. Within all those
Yeah.
documents, typically sit in the fax queue, the prescriptions, the referrals, the lab reports, the progress notes, the clinical notes, all of those documents that tend to need human eyes on it and human actions taken on looking at the data, making sure it's correct, then inputting that data into a certain system and additional rules that go from there, like creating a new patient and all of those things. All those things are at times take away from the patient experience, take away from dealing and interacting directly with patients, because people are spending time on these low IQ tasks that are burdening them and leading to burnout, rather than effectively and precisely using technology in a way that can support them to do that in a much more streamlined way and focus again on what humans should be focusing on, which of course is the patient.
Absolutely. And to add on to this point, Gabe, which you rightly mentioned, well, at the end of the day, hospitals, healthcare systems are definitely trying to improve the patient experience. Now, think of an instance where a patient comes in and he needs to be treated at the earliest as possible, but he comes with a referral document from his primary physician and he is getting an appointment with the next doctor after 7 days. How can you use AI to shorten this particular 7 days period to 1 day? And the answer to that is automating this process without any errors. And that's why I think you can use AI as a tool to kind of automate this particular referral process instead of doing it manually, depending on humans to do it. And at times, even if you claim it that it's going to be done in 7 days, it might even go down to, rather than saying go down, I would say it can escalate to 8 days or 9 days. So that is not helping the patient experience at all. Patient wants to get the services as fast as possible. And the way to achieve that is to leverage the new technologies that are available, I would say.
Excellent. Speed matters. And it's interesting the comment we're receiving now in terms of Medicare, RCM. That's a good stat right there. So let's actually shift there to the Medicare side. So
absolutely,
a lot. And let's talking about like T codes. That's an area that we helped several community health centers with, adding T codes, removing T codes within the Medicare space. Tell us a little more about what even is a T code, and why would a provider need help with that and doing it manually versus actually utilizing AI and automation to help with that?
I mean, that's an excellent question that popped up. We are talking about community health centers today. So we do know that the largest payers for community health centers would be the public insurance companies like Medicare and Medicaid. So yeah, that should be the type of discussion we should have today. Talk about T codes, and even I would try to take up the point that came as a question, which is the Medicare RCM related question. So what are exactly T codes? T codes in Medicare is a subset of the HCPCS system, which we call as the Common Procedure Medical Coding System in US. Why is it so important? The reason T code is important is because it kind of indicates the wide array of services community health centers provide, which includes, case management, which includes nursing services, which includes telehealth services, and the list of services goes on. So T codes is very important. But the significance of T codes is, Gabe, if you do not have a proper use of T code as a community health center, you won't get the proper reimbursement of the services that you have already rendered. So that's why, to streamline billing and make claims processing more efficient, T codes or proper use of T codes is very, very important, and it's vital for the financial stability. Talking about Medicare RCM, and Gabe, if I may pick up the question for a second. Well, it's interesting this question has popped up. Traditionally, we have always relied on humans to log into these insurance portals, to log into insurance systems and do those manual, tedious work, be it claims processing, be it doing a simple prior auth, be it even checking the insurance coverage of a patient. These days, we don't need to do that. I'll explain this with an example. So we recently started working with a community health center based out of Phoenix, Arizona. And their main challenge was they had a medical billing team. They wanted to process the claims as fast as possible. And the exact use case was adding T codes from Medicare, validating the T codes, removing the T codes, and then finally updating the self-pay of the patients inside their electronic health record, which was eClinical Works. Were they not able to do this process? Of course, they were able to do this process. But the issue was the time they were taking to get the reimbursement was becoming a long cycle. What we did instead is we re-engineered the process a little bit. We tweaked the process a little bit. We used bots that typically would go into eClinical Works with a concept called user interface automation. Like a bot is having a username and password to log into eClinical Works. The bot then logs into ECW. It goes into the home screen of ECW and it searches for the claim with the claim number. Once it identifies the claim, the first thing the bot checks is whether that particular T code exists or it's not yet added. If it's exist, well and good. You don't have to do anything. If that particular T code is not added, the bot is going to add it, and then finally it's going to save the claim and start processing the next claim. Now, let me once again tell you the consequence of this particular automation. The metrics that we did receive from this community health center is that they were processing 2,000 claims per day. It wasn't taking long, it was taking 20 seconds per claim. But even if you multiply 20 seconds into 2,000 claims per day, the number becomes almost like 11 hours. Now, it's not just about saving 11 hours, it's also how fast the company can process these claims to get the reimbursements. It's also about the accuracy of the claims. Bots typically are coded in a way in which it cannot make mistakes because these are rules-driven processes. Humans are doing the same process over and over again. It's a tedious process. You need to constantly monitor the claim number and the T code. So you get the difference, Gabe, right? Like how fast we can kind of change the claim processing conversion time. That's one example that I wanted to kind of present it to the viewers out here.
So essentially what's happening here is that it's not just about the time savings, but the biggest piece that providers care about is how can they make more money or how can they get paid faster? And that's
Absolutely.
the same trend of that's why speed matters, because lack of speed means you either get paid slower or don't get paid at all. And you can't always
Correct.
have that in your AR just sitting there. So the point is, so let's actually turn that into a question. So basically talk to me a little more about claims processing, denials management, reducing denials. Like how, if a provider is standing here and saying, okay, this is great. I understand automation from a time saving perspective, but I need to use it to get paid faster, to make more money, to really not only augment my staff, but almost have technology be a revenue generator for me. Like tell us a little more about how denials can be reduced and how this can help providers make more money or get paid faster.
Yeah, absolutely. And that's a very good question because that's a question which is perhaps top of mind for all chief financial officers. I did this poll on LinkedIn, I think a month back, like what's one of the top priorities of CFOs in medical practices? Fastening the turnaround time of AR seems to be a top of mind issue which they want to solve. Let's talk about how technology can be a big driver to generate revenue for healthcare providers. And it's not just about time savings and efficiency and all those stuff. Claims processing is the first point that you asked. So, typically we have relied on the revenue cycle management units of a medical practice to perform tasks like logging into a portal of Medicare or logging into the portal of United Healthcare if it's a commercial insurance, and trying to search for the patient's claim with the patient's information that it is availing from the EHR, like a date of birth, a first name, a second name, a first service date, a second service date. Then essentially moving into the claim section, like literally clicking on tabs and buttons to navigate to the claim section of this insurance portal, finding the status of the claim, seeing whether it's finalized or approved or pending. And depending on that, collecting all the line items that you need to basically procure in order to get the claims kind of passed on. For example, what's the billed amount? What's the copay? What's the denial code if it's denied? What's the denial description? And bring this data along and then start analyzing it. Now, let me tell you this, starting from logging into United Healthcare till bringing these information from the claim section of United Healthcare portal, these are all very repeatable, mundane, tedious tasks. You certainly don't need to put any brain work to get this thing done. Why don't you use a technology called robotic process automation to get this thing done? Why don't you use AI even to synthesize certain information, contextualize it, and bring some meaning from it? I mean, that's one section where you can typically address the claims piece. I know, Gabe, you talked about denials management. That's a huge thing in medical practice. Like, typically, we see denials as an area where you need to spend a lot of time on investigating why the claims were denied in the first place. Gabe, let me give you a staggering stat here. I just read this recently on LinkedIn. 10% of the denied claims are appealed. 90% are not going to be kind of appealed. So that gives you the complete scenario. It's better to use AI as a preventive denial case rather than trying to investigate why the claim got denied after it has been denied. So can you use AI to literally have your findings, find those areas XYZ on what conditions and scenarios, if are not matched, this particular claim would be denied? Can you find those reasons? Can you investigate those reasons before submitting the claim? You can certainly do that. And the way you can do that is by using the AI models that we have available right now. And this is going to be a major breakthrough when it comes to using AI for denials, because like you said, denials is a very, very important thing because it is entirely dismantling the financial stability of a healthcare practice based on the stat that I just provided.
Well summarized. And I do want to get into a little bit about eligibility verification in a second, but it's staggering because the idea around here is that there's so many pieces of technology you can utilize. But if it's simplified, like when the whole boom around generative AI happened, it was all about how can I basically use it as a search engine, which is extremely effective. That's great. But if you take a step back and look at the vision, it's more so unstructured textual data is everywhere. And if you can leverage AI to understand it in very fast speed with high accuracy, especially when there's high volumes of unstructured data, that can significantly help you in a lot of areas. And the one that Ron was mentioning is specifically understanding why even it was denied in the first place. Like that's step one to making sure then you can layer simpler automation tools like process automation to take on additional rule-based tasks to then not just be a statistic and have 10% of the denials basically only be appealed. Maybe you can have significantly more. So the general idea here is that there's a lot of areas that you can leverage with automation, not just have to do every single thing manually. For example, the 11 hours you mentioned that the community health center was spending and people were spending on simply adding and removing T codes. So tell us a little more about eligibility verification, how this is automated, why that matters. Tell us a little more.
Yeah, absolutely. Now, eligibility verification is a very simple process. If you think from a very high level, eligibility verification is just checking the coverage of the insurance of the patient before you render the service to the patient, right? This is eligibility verification. Now, all the typical EHRs that are available in the industry, be it eClinical Works, be it a NextGen, is going to provide you with a tab, with a navigating button on their particular EHR, where you would be able to filter the patient based on the type of insurance. So I click on a button and I get to see the list of patients which is covered by Medicare. What do you do next? You try to go into the carrier portal's website, be it, let's say, Medicare, and you try to find that particular patient. Once again, how do you try to find that particular patient? You already got hold of the patient's information, demographics, state of birth, and stuff like that, which you need to basically enter into Medicare portal to find that particular patient. Once you find that particular patient, the next thing you're looking for is finding the status of their insurance coverage. I know we are doing a webinar today on community health centers, so a lot of focus would be on Medicare and Medicaid. So typically in scenarios like this, what we did is we used a bot that goes into the Medicare portal and tries to find whether the patient is covered by Medicare, both plans A and B, or it's not covered by Medicare at all, or whether the insurance coverage has expired 7 days to 10 days back. We take that status and we then update it into the EMR with the help of bots. So this is what patient eligibility of verification is all about, Keith.
Absolutely, and it's beautiful that when automation technology is in the stage that it's truly EHR agnostic, especially in an industry where interoperability is so important. Just being able to integrate different EHRs, different systems, or different even websites. So I think that's a beautiful thing, whether it's eClinicalWorks or Epic or NextGen or Cerner or Meditech. I mean, all of the top EHRs, even the smaller ones or the ones that are more niche, can be basically have tasks automated with automation technology that exists, and it's not as difficult. So that's a huge point there. Let's talk a little bit about some of the key metrics. So like, what are the key metrics and outcomes that community health centers should find and should use to kind of measure the success of AI-powered document automation or AI-powered process automation? And so tell us a little more, like, is it really time savings? Is it human error? Is it like the speed of claims processed? Is it just their staff productivity? Like, how should they measure that? Because AI is great, but you need to use it for a very specific thing, and you have to make sure that you have a clear vision and way to measure if it was successful, so you can keep going and get out of just the pilot stage where a lot of companies just stay in the pilot stage and never move on from there. Tell us a little more about that, Ronald, how you measure that.
That's a good question, and I would say, regardless of whatever we discuss, we do know the reality is community health centers operate with significantly lesser and tighter IT budgets compared to a large hospital firm. That's a reality. So you certainly cannot expect a community health center to invest $500,000 on AI without even trying to feel what's the impact is going to be in the next 5 years. The first thing that I would say is focus on high impact areas. Based on our experience of working with other community health centers, the high impact areas lies in patient scheduling, lies in patient intake. A significant chunk of work that your revenue cycle management team does within this carrier portals, within the insurance systems. So you have to first find out which are those areas where I have multiple FTEs doing the same amount of mundane, repetitive job day in, day out. I wanted to mention this point about tighter budget because of one simple reason. What we have seen is when healthcare systems try to kind of procure a AI service or a AI program, they would definitely see whether I am investing in an AI platform that's going to save me 3 FTEs or more. If it's going to save me 3 FTEs or more, I will take a shot at it. But on the flip side, if I am investing in a solution which is costing you almost like 3 FTEs, but I don't see significant savings there, that's not a good point to start. Why did I make this statement? The reason I made this statement is because I would advise community health centers to find those AI solutions which are scalable in nature, which has a scalable pricing model. Like, you pay very little for the upfront cost. Obviously, you build a process automation bot, you're paying for it. That's not like a more than 15 grand, 10 grand that you're investing in building a process. But from there onwards, the pricing becomes more scalable. For example, if I have 25 bots running for 24 hours a day, I'm going to pay for those 25 bots for 24 hours. If I have X amount of volumes of documents from where I need to extract the data from, I need to basically pay for those X amount of pages where the data is getting extracted from. Rather than, I should have, as a community health center, I should have the preference of scaling up or scaling down based on my preference. That's the ultimate point that I would advise, Skip.
Absolutely. So I think it's very, very well said. And I think another that also brings up the point of even um, duplicate data entry. So we talked a lot with our clients of, hey, did you know that half of data entry within EHRs is duplicate? You don't need to fix that problem. You need to just automate it. That just means that there's so much copy paste going on, which people don't need to do. That can be automated because it's basically fully rule based. So tell us a little more about let's dive deeper, because I wanted to actually dive deeper in terms of like the what's next, like what's the future of healthcare automation in 2025. But we actually haven't dove deep enough into the intake process. Tell us, like, in terms of the intake process, what is the difference between someone or a provider doing this fully manually, doing this with automation? What is the impact of it? Tell us a little bit more of that and how that's changed in even 2024.
Yeah, absolutely. Patient intake process is obviously a big area where I think a lot of healthcare providers have already started leveraging AI from the start of 2024. I would say this: the future of health systems in general lies in the fact where you can augment artificial intelligence with human intelligence. Let AI do what it is best at, let humans do where strategic tasks are required. Coming to the point which you said, the patient intake piece. So think for a second, what is this patient intake process? It's essentially patient related documents coming and hitting your electronic health record. You have a dedicated 8, 9, 10 member team whose entire job is to first figure out the faxes that are hitting the electronic health record or any other stored folder where you have the faxes coming in. The second thing they would do is identifying what those faxes are, like the fax that came in. Is it a batch referral fax, or it's a prescription, or it's a clinical note, or it's a lab report? Because based on what that particular fax is, I need to essentially grab some data and post process it manually. Now, think for a second, as we are talking about patient intake, let's take referral fax as one instance. A fax comes in, which is a referral fax. The first thing a patient admissions member does, it goes in, he or she basically goes into the electronic health record, finds a particular fax, identifies that whether that's a referral or that's a non-referral document. If it's a referral document, he is then trying to scan the information with his naked eye and trying to grab information like patient first name, second name, healthcare ID, referring physician, medications, and stuff like that. The next thing he is doing is where most of the time is spent on, which is manual data entry within the electronic health record. Which is, if it's a referral that came in where the patient does not exist inside the electronic health record, I need to manually create the new patient and add the document to the patient's chart. Now, that's once again, on an average, we see you're spending around 5 to 6 minutes on just creating one patient inside EHR. Once again, if the patient exists, all you're doing is you are finding that particular document of the patient and attaching it to the right patient inside the EHR. Now, this is kind of referral process automation, bigger part of patient intake, which you just explained me shortly. Now, you simply do not want to limit AI or computer vision or LLMs to do referral processing. Tomorrow, you might need to have lab reports getting extracted in the form of faxes, data to be pulled from lab reports into the EHR. You can do that too. The third use case could be prescriptions. It's not just community health centers, but healthcare providers in general get a large volume. This is sheer volume of prescriptions they receive from pharmacists and different other prescription oriented groups. What are they doing next? They're looking at a prescription which is, not always typed in nature. Most of the prescriptions these days are also handwritten in nature. They need to get a hold of the data inside the prescriptions and then add it in the system of records. So all sort of work that is happening in the front end side of things, which is the patient admissions team's work, can be efficiently automated with the help of AI. The question is, do you still want to do it 100% manual? do you still want to outsource this process to a country like, a company from Philippines or India who is going to do the job for sure but might take 24 hours to give you the data back? Or you want to use the technologies that is available like AI and automation to do it almost instantaneously, and obviously have two set pair of eyes, like two full-time employees to review the work done by AI, instead of putting 10 people to do it almost like in a elongated redundant fashion.
Yeah. This brings up two very good points. Number one is talent and the talent shortage in the healthcare industry. And number two is cost effectiveness. So, in terms of talent, it's so important whether it's an MRI tech or whether it's the coding team or whether it's team focused on prior auths and calling payers, whether it's your patient intake team. It's not easy to get quality talent. And sometimes the conversation is around, oh, FTE reduction. That's not always the case. It's more so time savings because those FTEs or those people are so valuable that you don't want them focusing on those low IQ tasks. You don't want them
Right.
focusing on that drudgery because that takes away from the amount of creative work they can do, from the amount of patient engagement they can do, for the amount of time they can be spending supporting their other staff members. There's so much other work they could be doing rather than the low IQ tasks. So that's a piece that's so important, that you can utilize automation to make sure that you can keep growing your volumes, but not necessarily if you grow your volumes 40%, have to grow your staff 40%. Maybe you grow your volumes 40%, your staff grows 10%. That's the way to really approach it, and to use automation and generative AI efficiently. And really, it's more so you don't have to necessarily use generative AI. Use an automation company that's already layered in generative AI in ways that can specifically help you, right? That's the best way to do it, because really, who did generative AI impact? The existing technology companies that are already providing services to the providers. So that's just to make sure who you're working with is not using antiquated technology or historical technology. For example, when it comes to unstructured data, a lot of the machine learning OCR based approaches have quickly gotten antiquated. You want to be very careful with trying to try to grab data from a document based on the positioning of that data. That's something that's going to take you a very long time. You're going to have limited accuracy. And really, the generative AI boom has made that almost obsolete. You want to make sure that you're having speed. You don't want another technology that's going to slow you down even more. It has to be extremely clear how it's helping people. Number
Right.
two is cost effectiveness. So a lot of providers are in one of two situations. Either they have limited AI budgets, or they have AI budgets that are significant, but that are being looked at with a magnifying glass. You invested X? Are you genuinely getting return on investment on what you on what you invested in? Because otherwise, the rest of that budget might be frozen or might not be used. So these initial projects are key, as everyone always talks about crawl, walk, run. And it's not just to say it is true. Like, you want to start slow. Think of an end-to-end solution you want. Start with the biggest bang for your buck, a part of that solution, build it out, and then keep going from there. For example, when you're automating within insurance portals, you don't have to automate every insurance portal at once. Start with the ones that have the highest volumes and work from there. And then maybe you might get to some portals that have 1 or 2% of the volumes that maybe you don't even want to automate. You want to maybe keep that manually because it's so it doesn't happen often enough. That's the approach you need to take to effectively support your people with technology, because the point of technology is just to support people. It's not to replace people. So that's the part of it. And lastly, when it comes to AI is based on humans. And at times people expect AI to be 105% accurate. The reality is that it's based on humans, and therefore AI is flawed. Although AI is flawed, in many cases, especially when it comes to understanding unstructured data from these referrals, prescriptions, lab reports, from understanding what a denial is, it's significantly faster, it's significantly more accurate, and it's super helpful to utilize. So if a provider that's growing, that's nimble, is using AI to support their staff, and then they're competing with a larger provider that took 18 months doing due diligence on these AI projects, they're catching up pretty quickly. Things are very quickly changing in 2024, heading into 2025 on quickly leveraging automation because it shouldn't take that long. If you're looking at AI projects that are taking 12, 18, 24 months, well, by the time you're done, there's new technology that probably you could have done it even faster. So you got to be very careful with that. It has to be quick hitters. It has to be things that are nimble. It has to be things that you can utilize and at times replicate for other pieces of the process. So those points are extremely important, Rano, in terms of cost effectiveness and utilizing automation and AI to help you with the talent shortage, especially if you're in parts of the country that you're more in the rural parts of the country or the middle parts of the country where you may actually be losing some of your staff to the edges of the country that at times can compensate higher. We've actually had several clients deal with that, especially for remote work. So the point is automation is also remote. So that's the other piece of it, is leveraging that to truly digitally transform and change the way you operate.
Absolutely. And that's a fantastic point. I mean, I can lean on to the last point you mentioned, like an AI program taking 12 months, 18 months. It shouldn't be the case. So, one of the things that we have seen so far, which is working successfully with most of our clients, is that a pilot program. Let's start with a pilot program. You don't have to think about a full scale rollout in the very first instance. You do a pilot, see what AI can do in the first 4 to 6 weeks, and then take the decision from there. And I think AI has grown. I mean, of course, it's just the start of the new era when it comes to AI, but it has grown to a level in which AI can be significantly used to show you efficiency inside the first 4 to 6 weeks based on the process you're looking to optimize. Let's say, could be patient intake, could be something within revenue cycle management. Let's talk about prior authorization, medical coding. Think about a process where you think, if I could use AI, I can definitely save 2 to 3 FTEs and reallocate them to some high value task. That's the approach I would say, Keith.
No, absolutely. I think it's a wonderfully made point. So I think we discussed the future of automation within the healthcare industry. The last point we want to discuss, I think it's very important for us to discuss, is how do you get started? You touched upon it a little bit, but so many providers, because again, generative AI happened. And then all of a sudden, everyone wanted these super fun use cases of using it for customer engagement and patient engagement and all these things. And that's excellent. And you can do that. But when the generative AI boom happened, there were still all of these back office administrative tasks that have not been automated for the majority of the industry. So you still need to address that. You should actually be automating the things that aren't fun, right? Because usually if it's not fun for your employees, then it's not fun for your employees. They don't want to do that. You want to make sure your employees are motivated and doing things that inspire them, motivate them, and that can have them continue pushing, not things that make them want to rip their hair out if they have hair. So the point is here that basically how can a provider actually get started? Tell us about like the steps of how that works, Rano.
Well, I think it's not that me being someone who loves to speak, but in reality, people would love to speak with one person rather than doing data entry within any system inside a particular machine, right? So that's a reality of human psychology. Let's talk about 3 areas where you can pick and choose which one you want to start with when it comes to AI implementation for health systems and healthcare providers. Think about the patient intake process. Let AI and automation do the clinical documentation. Let AI and bots do the work inside your EHR, and you call a patient and schedule those appointments faster. That's the first area I would say. Once again, going back to a second point, which is revenue cycle management. Let AI agents do the work of claim submissions, and you, being a revenue cycle management, the one thing you're good at is talking to the insurance company, following up with them, and telling them, hey, this is a claim which shouldn't have been denied in the first place. Do that voiceover piece by yourself and let AI do the submission piece of claims. And finally, I think a simple place to start is, eligibility verification of benefits. I mean, it's so simple for a bot to check the coverage, insurance coverage of patients by logging into insurance systems, right? You still, in today's world, don't need 2 to 3 member team who is doing that for you. So I would say, to summarize, patient intake being one, Obviously, number two being the revenue cycle management task, where you have a lot of people going into insurance portal doing the same thing over and over again. And the third task is verification of insurances and eligibility checks.
Absolutely. And to wrap up, in each of these three examples, you should not have to change your process to automate it. If it's not ready for automation, then that usually means you need to change your process because it's not that efficient yet. You need to usually optimize your process and then automate it. So it's very important that you keep your process as is and then bring in automation to do it almost exactly as you do it today, because that way it's easier to manage from the people that were previously doing it. Now, if there's 5 people doing it now, that one person who was one of the key subject matter experts doing the process can take a step back and just manage the process and take 5 or 10% of their time managing it versus actually doing it. That's the vision of what you can and can't do with automation. And lastly, always have a vision in mind, right? Even if you start, you mentioned pilots, even if you're starting with a pilot, you still have to have the vision as a part of it. And the pilot needs to make sure that you have staggered points throughout implementation where you have actual value added, where you're not just saying, you know what, after these 2 years we'll have value. No. Throughout those 2 years, if it's that long of a project, there should be value added in month 1, then month 3, then month 6. There should be specific, basically, touch points where you can leverage what's been built and what's already being automated. So that's a general approach here at Rana. So I think, thank you very much for your time here, Rana. I think this was an informative discussion. Any final words from your end?
No, I would say that, today we tried to really dig a little deeper on why community health centers should use AI. And perhaps I was able to add some value to the attendees who were a part of this webinar. That's kind of my final thought. If you have any questions or any comments that you want to add based on the discussion we had, I'm going to basically add my email ID on the comment list of this webinar, and feel free to ask me questions at any point.
Excellent. All right. Thank you all.